Hello and welcome. Today, we're diving into the complex world of autoimmune encephalopathy, a condition where the body's own immune system mistakenly attacks the brain. We'll explore what causes this, how it affects the brain, its symptoms, diagnosis, treatment, and what the future holds for those affected by this challenging disease. The exact cause of autoimmune encephalopathy is often elusive, but it boils down to a misdirected immune response. Instead of targeting foreign invaders, the immune system produces antibodies that attack specific proteins or receptors in the brain. These proteins and receptors are crucial for normal brain function. Sometimes this misdirection is triggered by an underlying cancer, called a paraneoplastic syndrome. Other times it may arise after an infection, or seemingly out of the blue. The underlying trigger may never be identified, making diagnosis and treatment even more complex. When these autoantibodies attack the brain, they disrupt normal neuronal communication. They can bind to receptors on the surface of neurons, blocking their function or triggering their destruction. This inflammation and disruption can affect various brain regions, leading to a wide array of neurological and psychiatric symptoms. The specific area of the brain affected and the specific antibody involved dictates the particular symptoms a patient will experience. The inflammatory response damages neurons and disrupts the intricate balance of neurotransmitters, essential for proper brain function. Autoimmune encephalopathy is a relatively rare condition, making it challenging to gather precise epidemiological data. However, studies suggest that it accounts for a significant percentage of unexplained encephalopathies. It can affect people of all ages, from children to older adults. Although certain types of autoimmune encephalopathy are more common in specific age groups or associated with particular cancers that have age-related incidence, increased awareness and improved diagnostic testing are likely leading to increased recognition of this condition. The symptoms of autoimmune encephalopathy are incredibly diverse and can vary significantly from person to person. They can include rapid onset of memory problems, confusion, altered mental status, seizures, movement disorders like tremors or dystonia, psychiatric symptoms such as psychosis, anxiety or depression, sleep disturbances, and even coma. Some individuals may experience problems with speech, coordination, or vision. The variability of symptoms makes it critical for clinicians to consider autoimmune encephalopathy in any patient presenting with unexplained neurological or psychiatric symptoms, especially when they develop rapidly. Diagnosing autoimmune encephalopathy can be challenging and often requires a combination of clinical evaluation and diagnostic testing. Key components into thorough neurological examination, a detailed review of the patient's medical history, and specialized tests. Blood tests and cerebrospinal fluid analysis can help identify the presence of autoantibodies. Magnetic resonance imaging, or MRI, of the brain may reveal abnormalities such as inflammation or lesions. Electroencephalograms, or EEGs, can help detect seizures or other abnormal brain activity. If a paraneoplastic syndrome is suspected, a search for underlying cancer is warranted. Autoimmune encephalopathies are often classified based on the specific autoantibody involved. Some of the more well-known types include anti-MDA receptor encephalitis, LG1 encephalitis, anti-GABA receptor encephalitis, and anti-AMPA receptor encephalitis. Each type is associated with different clinical features and prognosis. Classifying the specific type of autoimmune encephalopathy is crucial because it can guide treatment decisions and provide valuable information about the likely course of the illness. The primary goal of treatment is to suppress the immune system and reduce inflammation in the brain. This typically involves the use of immunosuppressant medications such as corticosteroids, intravenous immunoglobulin or IVIG, and plasma exchange. In some cases, other immunosuppressant drugs, like rituximab or cyclophosphamide, may be necessary. If the autoimmune encephalopathy is paraneoplastic, treatment of the underlying cancer is crucial. Rehabilitation therapies, such as physical therapy, occupational therapy, and speech therapy, may be necessary to help patients recover lost function. Unfortunately, there's no definitive way to prevent autoimmune encephalopathy. Because many cases arise from unknown causes, prevention strategies are limited. Maintaining a healthy immune system through a balanced diet, regular exercise, and adequate sleep is always beneficial. Prompt treatment of infections may potentially reduce the risk in some cases, but more research is needed to understand the specific triggers and develop targeted prevention strategies. The prognosis for autoimmune encephalopathy varies widely depending on the specific type of antibody involved, the severity of the illness, and the timeliness of treatment. Early diagnosis and aggressive treatment are crucial for improving outcomes. Some individuals may make a full recovery, while others may experience long-term neurological deficits or cognitive impairment. Recent research is focused on identifying new autoantibodies, developing more targeted therapies, and understanding the long-term effects of autoimmune encephalopathy on the brain. Scientists are also exploring biomarkers that can help predict treatment response and personalize care for patients with this complex condition. Clinical trials are ongoing to test new treatments and improve the overall management of autoimmune encephalopathy.